What's going on, everyone? So you've hurt your lower back and you want to avoid reoccurrence. What do? So in this video, we're going to talk about ways to move and ways not to move to make sure that doesn't happen again. We're also going to cover some stabilizing exercises, and we're also going to cover some sample exercises you can do to strengthen the back for the future. So the first thing we need to learn is how to brace the core. And that means how to stiffen up so that the whole torso moves as one unit. There are going to be 3 variations of bracing that you're going to try, and you will find one is better than the other. The first one, imagine you're about to get punched in the gut. You stiffen up, and that's how you brace there. The second one is we're going to contract the back muscles by bringing the shoulders back and down. That locks your lats in place, so more of a posterior brace. And then the third one, we're going to take our fingers, stab them into the soft sides of your lower torso, so right below the ribs and right above the pelvis, so that you're not pressing into any bones. And with your strength, with your muscles, push those fingers out. Okay, so you're going to try those 3 bracing actions as you go around lifting or moving in ways that would normally make your lower back pain act up. And you'll find one helps you move a lot better than the other. Next up, the number 1 movement you need to avoid doing under load. That is twisting and bending the spine under load. So how many times have you heard someone, oh, I pulled my back, I was just reaching for the laundry, I was just putting some pots away. That's because they were twisting their spine, okay, and bending it. So when you combine both of those movements, that puts the most strain on the discs. What should you do instead? We're going to cover hinging and pivoting. So in order to avoid that number 1 movement you want to avoid, which is the twisting and the bending of the spine, we want to learn how to hinge first. Now, hinging means moving at the hips instead of moving at the spine. Why is this important? Well, we also want to stop picking the scab. So imagine you have a cut and the scab forms. If you keep scratching at it, you keep peeling it away, and it doesn't heal very well. And that's what we want to do with our lower back. We want to stop picking the scab. So as we recover from that injury, we want to not move that as much as possible. So the first thing here is getting a stick. Now here, we're going to put the stick behind us so that there are 3 points of contact with the stick. Behind the head, between the shoulder blades, and by the tailbone or sacrum area. The top arm is going to go right by the neck, palm facing the neck. The bottom hand is going to go on the small of your back, palm facing away. Now we want it there so that we can keep the slight curvature to the spine. Now if you have really bad shoulder mobility, you can try doing this with the palm facing you instead. So here, I'm going to have the feet straight. Keeping those 3 points of contact, we push the hips back and figure out and learn how to hip hinge. Once you have your hip hinge down, now we want to learn how to pivot from the hips so that we avoid that bending and twisting position. So when I come down, I can use my hips now a little bit better using that bracing method. But if I want to twist, I pick one heel up. That way the pelvis can move from the hip joint. And that's where our rotation comes in, from the hips and the feet. Now, as you are moving through space, like most people are going to have to move, we want to help ourselves up as much as possible to eliminate that bending and twisting of the spine. Something you should probably try to do is use objects that are not going to move to help you brace yourself as you go up and down somewhere. So if I have to pick something up or have to squat down, I'm gonna put my weight on this chair and I'm gonna squat while keeping my torso as upright as possible because that's gonna put the least amount of torque on the lower back. This will also apply when putting shoes on because people will struggle with that quite a bit as well if their lower back pain is flaring up. So imagine I just slid my shoe in a little bit. I'm gonna use a chair or a bench to bring my foot up. And now I'm still trying that bracing technique. I'm gonna go down, bring myself down towards it, and then finish putting the shoe on, okay? And here, if I bend from the upper back, if I learn how to do that, that's gonna be easier on my spine as well, my lower back, to come in and finish tying the shoe. So you're trying to bring things up towards you. Next, we need to learn how to get down to the floor and back up, but as well, you can use this for getting on and off bed. So what I'm gonna do here, I'm gonna place my hands on my thighs and I'm gonna slide them down, keeping that brace that I learned to use. Into the hands are right above the knees. So I'm here, I'm in a little bit of a hinge position. From there, I'm gonna shift my weight to one leg, putting both hands on that leg, take the other one back, and come down. Now I can take both knees down. Again, I'm staying fairly upright, and I'm gonna do the same thing I did when I was standing. Hands on the thighs. You can sit back if possible, or lean forward if you need to, and then get the hands on the floor. From there, we crawl out, forearms go on the floor, I take one leg out, and I slowly roll, keeping that tension through the torso onto my back so that we can get into our exercises later on. And you can do the same thing coming back up. Roll up, all in one motion onto the elbows, come up to the knees, walk up into that kneeling position. One leg is planted, have the hands on the thighs, plant the toes, push up, and now you're up again. All right, so we know how to brace, we know how to hinge, we know how to go up and down from the floor, trying to eliminate that lower back pain and how to not re-aggravate that injury, how to stop picking the scab. So we're going to go through some stability exercises. And why are these important? Even though we're not targeting the back specifically, a lot of people have a lot of different movement patterns that are not optimal. And that's usually why those lower back injuries happen, because the hips might be tight, not moving well, there's not the right core stability going on, so the lower back muscles are overcompensating, things like that. What specifically happened to you, you will have to visit a physical therapy to know a little bit more of a better assessment to individualize the approach. But these are really good exercises to do for anybody. First up, we're gonna work some breathing. We can use a chair or have the feet on a wall. Either way, we're gonna have the knees and the hips bent 90 degrees, feet point straight up. Now, most people usually breathe a lot into their chest, especially when they have lower back injuries. So what we're gonna do here is take one hand on the belly, the other one on the chest, and notice as you breathe normally, which hand moves the most. If it's your chest, we try to figure out how can I make that breath, that inhale, go into the belly more. Once you get that down though, that's not it. That's not the end. Now that's usually where a lot of people stop. But what you really want to do is take your hands and touch your lower ribs here. And instead of just pushing the air up into the belly, you want to create a 360 expansion of that lower torso. When you inhale, preferably inhale through the nose, and you can exhale through the mouth. But now we're creating a 360 expansion through the front, through the sides, and the back to really make sure the diaphragm is working fully. Next, we're gonna go into the McGill Big 3. The first one being the crunch. So lying down, one leg bent, one leg straight, If we can, we take both hands under the small of the back where that lower back curvature should be. If your shoulders are tight and you can only get one in there, that's fine. We go the other hand on the chest. If both shoulders are really tight, then get a little towel, roll it up, and put it right there to keep that lower back arch in place. And then we just have both hands here. Either way, we're gonna get the elbows off the floor. And as we exhale, we come up into crunch and squeeze all the air out as much as possible. Inhale, come down. So exhale fully at the top of the crunch. Inhale, back down. That exhalation, where we squeeze all the air out, helps us contract our abdominals quite a bit. Next, we have the side plank position. I'm going to start with my legs straight, and I'm going to bend the bottom knee. So this is going to make it a little bit easier. Now, I like to have people keep their top hand lightly on the floor when they hold the side plank, because that makes them turn slightly towards the floor, which is going to make those obliques work a lot more, rather than when most people do side planks, they're actually facing up and making those back muscles work harder. So here, I'm going to do the same with my breath as those crunches. Exhale, squeeze everything here. As I inhale, I'm going to bend the hips and push them back. Try to keep that spine in a straight, neutral position. As we go up and down. And of course, I can make it harder by doing this with legs straight, top leg in front of the bottom leg. And repeating. The last one of these McGill Big 3 is our bird dog taps. So I'm going to go on my hands and knees, hands under shoulders, knees under hips. From here, we want a long spine. So we don't want to be rounding like this or hyperextending, arching down. We want to be right in the middle. Also, a lot of people will collapse here with the shoulders. We want to push the floor away. From here, one arm's going to go forward, the other leg's going to go back, so it's opposite limbs. Now, without moving the torso, we want to stiffen up that torso like we're bracing. Knee and hand touch right underneath you. There's no spinal or pelvic movement as we do this. So we learn how to move from the hip and the shoulder without incorporating the spine into it. If you want to make it a little bit more challenging, because that can be pretty easy for some people, we put the thumbs together and the knees together. And now that's a little bit more challenging for our shoulder, hip, and core stability muscles. So now that we know how to brace, how to hinge well, how to get up and down from the floor, how to do some stabilizing exercises, what you need to do is once you have no pain, once it has settled down, maybe it might be hard to wait for some of you to not have pain, maybe just settle down. Do movements and exercises as much as possible that don't make things more painful. So going for walks is great. Maybe walking uphill would be a good option as well. But even exercises that target those back muscles a lot more will be good options. So doing exercises like the kettlebell deadlift would be great because you're starting to strengthen those lower back and hip muscles as long as you're doing a nice hinge. And exercises like the Superman hold or Superwoman can be really effective in strengthening the back muscles as well, more directly. So the more exercises you keep doing, the better, as long as they don't cause more pain, especially if we're strengthening the posterior chain. The more those muscles get stronger, the better. A lot of people, when they have some type of back injury, they start avoiding a lot of those movements, and those muscles get a lot weaker, which exposes them to further injury because now they can't tolerate as much force. So hopefully that helps, and let me know how those exercises go for you.